Hi everyone, welcome back to the channel once again. In this video, we are going to learn about Alagille Syndrome. Although it is a rare disease, but it is important for entrance exams like NEET PG and NEET SS. So let's begin. Alagille Syndrome is a genetic disorder and it has got autosomal dominant mode of inheritance. It is a multi-system disorder and it can affect liver, eyes, heart, kidneys, bone and others. Talking about hepatobiliary system, in this disorder, there is decrease in number of bile duct, which leads to decrease in bile flow and can cause cholestasis. And this leads to jaundice, hepatomegaly, itching, and pale stool and dark urine. As we very well know that vitamins and nutrients require bile for its absorption, and in this disease there is decreased bile flow. Hence, the affected child suffers from vitamin deficiency, poor growth, and poor weight gain. Deficiency of vitamin A can cause visual problems. Deficiency of vitamin D can cause bone weakness. Deficiency of vitamin E can cause developmental delay, and deficiency of vitamin K can cause clotting disorders. In cardiovascular system, many defects have been reported, the most common being peripheral pulmonary arterial stenosis. And murmur of this peripheral pulmonary arterial stenosis is an important clinical sign in suspected cases. And symptoms due to this includes dizziness, chest pain, cyanosis, breathlessness, and sweating. Other congenital heart defects associated with Alagille syndrome are tetralogy of Fallot, atrial septal defect, PDA, that is patent ductus arteriosus, and coarctation of aorta. The facial changes in this syndrome are broad forehead, widely spaced eyes, and pointed chin. And this is a typical facie which can be seen, and it can also be asked as image-based MCQ. Talking about other symptoms, in eyes, it leads to thickened lining of cornea, which is known as posterior ambryotoxon. Other rare features are butterfly vertebra, blood vessel stenosis, cognitive impairments, abnormality in kidney and pancreas. As we have already discussed that it is a genetic disorder and it has got autosomal dominant mode of inheritance. That means even a single copy of mutated gene can lead to this disorder. And 50% of the offspring can be affected. The mutation seen in this disease is in the notch ligand of JAG1. And this point can also be asked as MCQ. Now, talking about the diagnostic criteria, to suspect this disease, we need 3 out of the 5 features we already seen. That is, facial features, heart defects, eye abnormalities, liver disease, and skeletal abnormalities. Any 3 out of 5, if present, we can suspect this disease. In suspected cases, we need to do liver biopsy and look for reduced bile ducts. To confirm the disease, we need to do genetic testing and we have to see for JAG1 and Notch2 mutation. Now, talking about the treatment depends on the symptoms. That is, if there is vitamin and nutrient deficiency, then we can supplement them. Also, for cholestasis, we can use UDCA along with antihistamines, cholestyramine, and rifampin. In refractory cases, partial biliary diversion is required, and if it fails, then liver transplant is the only option. So that is it for the video, guys. Thank you so much for watching, and if you are liking such videos, then don't forget to hit the subscribe button.